Hi, good morning, everybody. My name is Paco Pangalangan, the Executive Director of Strat-Based ADRi, the organizer of today's event, and I am pleased and honored to welcome all of you to today's virtual town hall discussion entitled Enabling Health Solutions and Innovations to Improve the Philippine Public Health System. I'm excited to have so many participants this morning from the different sectors, from media, from the health sector, civil society, government, and of course the business sector. And I'm looking forward to today's discussion. To formally open the event, may I please call on Professor Dean Manhit, the President of Strat-Based ADR Institute, for his opening remarks.
Thank you, Paco. Can I be heard?
Yes, loud and clear.
Okay. Good morning to everybody. I'd like to welcome our speakers, our participants from stakeholders of Philippine society, from private sector, civil society organizations, agencies of government at the national and local level. Allow me to share some of my thoughts with a few slides, just to show how in our institute, the Strat-Based ADR Institute, have tried to understand the challenges that we have faced since more than a year ago with this global pandemic caused by this COVID virus. So allow me to share my slides. Exactly a year ago, I wrote this commentary in my regular contribution with the Philippine Daily Inquirer. I spoke of how the coronavirus pandemic has exposed the vulnerabilities and intricacies of governance and healthcare system in the country. But what I want to build on in my commentary, this was an offshoot of our first virtual town hall discussion in the existence of our institute. It forced us to go into virtual. And I spoke of the healing power of collaboration. The idea that dealing with the pandemic, dealing with this continuing health crisis, now even with its economic consequences, is about the whole of Philippine society working together. I was reacting to the national government's posturing of, it's all about the national government. I've always argued key is the national government, the local governments were the true frontliners in this COVID response, to the private sector, to volunteer groups, to civil society organizations. And now exactly a year after I wrote this commentary, we know where we are. We see this government data. We see where we are also in terms of testing. Considering we launched with the private sector, the task force, the government launched with the private sector, the task force, T3 as they called it then, testing, tracing, treating. But one thing that I wanted to share, I was hoping that this could be at the core of the discussion this morning, is the key role of innovation in the healthcare sector in addressing COVID challenges. We have seen globally how newly developed vaccines, accurate testing kits, regulatory compliant innovative treatments, high technology contact tracing apps, e-health services, and even an AI-powered public health management systems and technologies could be our primary weapons that we can utilize to combat the pandemic. And this is where the private sector could play a key role. And this was due to a reading that I encountered or a publication I encountered a few months back in one of the medical journals. And I'd like to quote, as a society, we need to deal with all the facets of the pandemic. We need to rely on all scientific disciplines. A wide range of innovations could be useful to fight COVID-19, from vaccines, drugs, medical equipment, innovation and testing. Innovation is not only about the creation of inventions, but also about their diffusion to society. When I was reading through it, it reminded me of what I wrote, again, exactly a year ago, that there was a crisis in governance. But in that crisis of governance, I saw an opportunity. When I spoke of the whole of society approach to fight this deadly and invisible enemy. This crisis is about saving lives, not politics, and it's a rare opportunity to fix our healthcare system, inclusive and sustained growth, and start a transformation towards a good and responsive governance. We want vaccine. We're hoping vaccine can really reach as many as we can at the soonest possible time. We have seen the role of the national government. We are seeing how important the role of local government units, but we also have to give credit to the private sector for playing their role. I'm referring to employers, business groups, investing and helping out to attain much needed vaccines for the country. And as early as last January, at the start of the year, I was already arguing it. We cannot afford COVID-19 vaccine delays because we were tracking this and we were quite frustrated as a think tank. If we want to achieve herd immunity, a well-coordinated and collaborative partnership between the national government agencies, local government units, and the private sector is important to ensure that the COVID-19 vaccine is made accessible at the shortest possible timeline. And we value in Strat-based ADR Institute since 2004 the role of the private sector, even in the challenges of Philippine society, public challenges of Philippine society. We speak of their role in a post-COVID economic recovery. But what we want to emphasize is that the private sector, in their capacity to innovate, in their capacity to invest, can be a reliable partner of government at the national and local level towards economic recovery and to overcome pandemic challenges. Allow me to end this welcome remarks. Might have taken so long, but I've become passionate about the key role of society. That it's about bringing different stakeholders from the public, private, and civil society sector together in discussions like what we're having this morning. It is our hope to raise awareness for the potential of current and future innovative solutions in the health sector. Health, as we track this in the different research that the Institute does with its partner researchers, is the most urgent personal concern of Filipinos. Millions of households are now struggling because of the disruptive effects of this health crisis. And this morning, we as stakeholders must proactively participate in a united drive to build a responsive and inclusive healthcare system, adopt measures that will ensure quality health services that are inclusive, adequate, efficient, and accessible, especially to the most vulnerable sectors of Philippine society. Again, good morning to our speakers, participants, and thank you for joining us this morning.
Thank you, Professor Manhit, for laying the ground for today's discussion. Indeed, A year after the pandemic, into a pandemic, innovative solutions are indeed very necessary, and as well as collaboration between sectors. So in the spirit of that multi-sectoral collaboration, let us now hear from our different speakers from our different sectors. And we will begin with none other than from our government, from the national government. We'll begin with Dr. Enrique Tayag, who is the Director for Knowledge Management and Information Technology Services, or KMITS, at the Department of Health. Director Tayag will be discussing the government's programs related to digital and mobile technologies being supported by the DOH to improve the current public health system. He will also be providing insights on the ongoing efforts of the government, particularly the DOH, to digitize the health sector. Director Tayag, good morning po. The floor is yours.
Good morning. Good morning. Hello, everyone. This is Dr. Eric Tayag. I'm the Director of the Knowledge Management Information Technology Service of the Department of Health. That was a very impassioned speech from Mr. Dindo Manhit. Okay. We got the message po. And I'm sure you'll also get some messages from us. Okay. If I may be allowed to share this screen now. Okay. Let's share the screen. I'm just going to put it in the slideshow mode. Okay. Okay, is the screen all right now?
Yes, po.
Yes. And the audio is fine?
As well, yes.
Okay. These are the updates on the Philippine digital health interventions. And thank you again and congratulations to Strat-based ADR for coming up with this webinar. Okay. E-health or digital health has its benefits, not only potential benefits, but real benefits. On your screen, you can see that we listed 3 of the important contributions of digital health, and this concerns telemedicine, that's remote consultation, health information systems that we need so that we are guided by our decisions, and tracking and notifications so that remotely patients at the comfort of their homes can actually be monitored for their health status or disease condition. Now, let's go into the specific of digital health interventions. For example, if we look at the health systems domain on health workforce, the inefficiencies include inequitable distribution, inappropriate or costly staff mix. There are e-health or digital solutions. Okay, on the right, you can see that we can have an information system for human resources for health. For the longest time, it's a bustle. Exactly how many doctors are available in the country? Are there specialists, for example, for developmental childhood conditions? Where do we get the oncologists? So we want to make sure that these e-health solutions provide us the information that we need. And when we go to essential medicines, the inefficiencies and which should not happen are irrational use of drugs. I remember that there are, for example, recommendations to certain drugs that have not been approved so far for use for COVID-19 patients. And of course, there is the issue on counterfeit drugs. And e-health solutions that are available include logistic management information systems so that there are enough supply to match the demand for these supplies. And of course, we can actually create a counterfeit drug detection system. Let's look at the other health system domains. This time, the healthcare service, the health system leakages. Of course, we want a better, improved patient experience. What the pandemic has taught us is that access to health services need not be physical or face-to-face. There are interventions that we can actually make use of, like telemedicine, so that inappropriate hospital admissions or overuse of procedures can actually be screened over virtual consultations. The e-health solutions, of course, are listed here, and the DOH primarily relies on electronic medical record systems. We collaborate with the PhilHealth so that e-claims or reimbursements are seamless, and therefore the efficiency is improved. There are health system leakages like corruption and fraud. And so there are even e-health solutions that address such corruption and fraud. The other domains concerns patient monitoring and community health, disease surveillance, and population health. This pandemic, we were able to launch through the DOH COVID-19 hotline 1555 teleconsultations that are available even on a 24/7 basis. We had to thank the involvement of the private sector because there were many volunteers for providing these telemedicine services available. And we are now going into the next stages with PhilHealth, wherein a home care package will be available so that those with mild COVID disease will benefit from such tools and applications. But wait, there needs to be a digital transformation. This will not occur in a vacuum. This is more than the public-private collaboration. There should be a vision. There should be phases by which we can actually have objective timelines so that we can measure our performance, we can evaluate. And so what can actually happen? What is the promise of digital health in the country? It can be leveraged to accelerate progress on sustainable development goals. And that's in 2030 when it ends. It must support many endeavors designed to achieve universal health coverage. It will ultimately reduce the cost for health services, but it must provide integrated, interoperable, and innovative solutions to common problems. It can enhance regulatory standards to ensure ease of doing business, and it must offer relevant technologies that builds capacity of remote and underserved areas and even communities and families. The digital health supports the universal health care. There are priority projects undertaken by different government agencies in partnership with international organizations and the private sector, and even families and communities themselves. All this will lead to the achievement of our goals for universal health care, namely, better health outcomes, more responsive health system, and more equitable healthcare financing. We are working on it. Our task is difficult. Even with the pandemic or the new normal, we have to focus on HRIghts, health information systems, registries for health priorities, infrastructure and connectivity, especially with the Department of Information and Communications Technology, telehealth services. We need the telecoms to help us with our applications, electronic medical records. Third-party providers are growing in number, but we want to make sure that the implementation of Universal Healthcare Act, the shoulders fall on the PhilHealth and the DOH regarding electronic medical records, e-supply chain management, skilled human resources for ICT. So ladies and gentlemen, our major priorities are just a few, but they will provide us the best impact. We have to calibrate for sure, but we cannot just stop and think about possibilities because everything starts now. Good morning and thank you so much.
Thank you, Director Tayag, for sharing a lot of the what do you call this? The initiatives, technology and digital initiatives of DOH. It was very enlightening, and I hope you can stay for the open forum later.
Oh, I have to apologize
Yeah.
because, okay, I'm a vaccinator.
Oh,
I have to vaccinate people in the Department of Health, and it's another job. I
of
don't want
course.
them to miss their jobs. Mr. Dindo Manhit, I apologize po, but I congratulate everyone. At alam ko hindi lang ito yung huli at sana po ay makasama ko po kayo muli. At maganda po yun, narinig ko po ang inyong mensahe. Tumagos po sa puso ko. Maraming salamat. Okay. Hanggang
Thank
bone marrow
you.
po yata, Mr. Dindo.
Thank you
Salamat
po.
po. Bye-bye po.
Thank you, Director
Thank you
Tayag.
po.
Thank you so much. Okay. So now we're moving on to our next speaker. Of course, another speaker. Our next speaker is also from government, this time from the local government. We have none other than Honorable Marlon Abigail Binay, Mayor of Makati City. Mayor Binay, as the Chief Executive of the country's main business district, will be sharing the perspective of a local government unit in responding in this current public health crisis and how the use of technology helps support the response. She will share Makati City's experience in providing efficient services to her constituents' public health needs. Mayor Binay. Good morning po.
Good morning.
Good morning.
Good morning to everyone. Nice to see Dindo again. It's been a while. Good morning to my fellow speakers and public servants and partners in the private sector. I would like to begin my presentation, of course, by thanking Strat-based ADRi for inviting me to discuss our digital initiatives. As you all know, Makati is laying the groundwork to become the country's first smart city. In 2017, our city entered into a PPP with NeoConverge ICT solution to provide a free internet connection to Makatizens under the Makati Public Wi-Fi project. 2 years later, we expanded the project with other PPP agreements with Globe Go Wi-Fi to cover critical areas such as City Hall, OSMAC, University of Makati, and 27 barangay health centers. The free Wi-Fi project aims to accelerate the enhancement of the city's internet connectivity to hasten the delivery of services and improve government processes. Many residents, students, and workers have used the city's free Wi-Fi to get reliable information, do their schoolwork, conduct online businesses, and work from home, especially during the pandemic. Since everyone is connected to the internet or the city's free Wi-Fi, the portal provides equal healthcare access for the rich and poor. Aside from cash assistance for Makatizens and business owners affected by the global health crisis, the portal allows Makatizens, non-resident workers, and businessmen to register under its free vaccination program, whether for flu, pneumonia, or COVID-19. In terms of our Bakuna Makati program, we have simplified the online registration process to 3 easy steps to encourage people to get vaccinated. To book an appointment, you only need to go to the portal, fill out the form, save your confirmation number, and after that, you will receive a text message that contains your vaccination schedule. On the day of the vaccination, our medical staff will verify your information using a valid ID and a confirmation number, give you the vaccination card with security features such as a holographic sticker, and print a QR code in the vaccination card. Check your vital signs, administer the vaccine, and monitor you at least 30 minutes to ensure that you do not have any adverse effects. As part of our post-monitoring efforts, we also have our dedicated personnel under the Health Emergency Management System Office and the Makati Rescue who are on standby and ready to answer calls if someone experiences side effects from the vaccine. To date, the city has opened 13 vaccination sites, including the Vax on the Go or Vax OTG at Circuit Makati, which was launched earlier this month in partnership with Ayala Malls. Initially, Vax on the Go was intended to accommodate bedridden patients and persons with disabilities. Now, Metro Manila's first drive-through vaccination hub is open to all Makati residents who want to remain inside their cars while being vaccinated. In a sense, this program reduces the number of people going to the other vaccination sites and help us implement social distancing measures. All they need is again to register in the portal, and if they do not have a vehicle, they can request tricycle services also provided by the city through the portal. As of May 19, 2021, we have given the first dose of COVID-19 vaccines to 50,983 persons and the second doses to 17,171. Personnel of the Makati Health Department vaccinate an average of 1,900 persons on a daily basis. In Makati, we use the GIS mapping to track actual time data on available vaccines and the total number of vaccines administered. We also indicate the number of registrants in our portal. Besides the vaccine from the national government, Makati has allotted 1 billion pesos to purchase the vaccines. Earlier this year, we ordered 1 million doses of AstraZeneca for 500,000 Makati Zens and are expected to arrive hopefully by July. I would like to highlight the significance, of course, of our cold chain management in storing the vaccines. Currently, the city government has over 100 transport coolers, 26 biofreezers, and 6 lab freezers, including an ultra-low freezer for Pfizer and Moderna vaccines. The cold chain management is also one of the basis for the allocation of the vaccines in the LGU. On a separate note, OSMAC also improved its Health Information Management System, or HIMSS, so that doctors will have quick access to patients' medical and diagnostic records during checkups and peer consultations. This system has helped OSMAC implement online consultations, or e-consult, and over 66,700 Makati were able to consult with doctors even at home. Based on our experience, the pandemic has made us realize that technological reforms are needed. I also have to admit that our capabilities were tested during the onset of the global health crisis. Nevertheless, with the cooperation of Makati and the private sector, we were able to implement various programs that aim to protect residents and establishments from the effects of the pandemic. However, at the end of the day, lockdowns and social programs are only effective if people will allow simple rules such as wearing of face masks and face shields, practicing social distancing measures, and following the curfew hours. And I'd also like to emphasize that vaccines are crucial for us to all go back to normal. To bring this to a close, let me share a video about our vaccination program. Again, thank you very much.
Thank you, Abby, Mayor Abby. It was again,
Thank
very
you.
impressive presentation, and it's nice to see all the initiatives that the city has been taking, especially as one of your daytime residents before the pandemic. So yes, at this point, right, I'd like to think, we've had our two speakers from the government provide their the long-term vision that the Department of Health shared, and of course on the ground how the programs are being implemented. At this juncture, we're going to now jump to our speakers from the private sector, beginning with Mr. Richard Harrison. Mr. Harrison is the Senior Business Development Manager for Thermo Fisher Scientific. And Mr. Harrison is one of the pioneers who introduced the forensic DNA technology across the Asia-Pacific region. His team also developed a pandemic preparedness portfolio that expands into a capability that now supports over 50% of the COVID-19 tests performed around the world. Currently, his focus is the creation of the transnational partnership to support COVID-19 testing that is crucial in allowing a return to work, education, and travel across Asia. So very interested to hear your thoughts today, Richard. The floor is yours.
Thank you very much, Director Pangalagan. Just a quick confirmation that you can see my first slide.
Yes, we can see your
Marvelous. Thank you very much. So thank you very much to Stratbase ADR and yourself for the invitation to come and talk. Until COVID-19 came along, it would have been extremely unusual to see a biomedical executive on the agenda of a Strategic Policy Institute seminar. We're very pleased to be here. And in this talk, I'd like to address a point raised in the opening by Professor Manhit, some of the limitations of testing that are out there. So the first thing to do is to talk about the sorts of testing that exist. What most people think of in something like COVID testing is what we would call diagnostic testing. That's traditional pathology, testing sick people. There's another area very commonly used, though usually it's pretty well hidden from the general public, and that is surveillance testing. That's testing mostly sick people to track important public health diseases, like influenza. Most countries do an influenza surveillance program during their flu season, and the result isn't actually used to guide patient treatment. It's used to track, what flu strains are out there, what percentage of upper respiratory tract infections are influenza, etc. Important public health information. Okay. And then there's a relatively new area called screening, and this is testing non-sick people. We call them asymptomatic. They don't have known or reported disease, or may not even have been in close contact. And these are the people that carry COVID around in the community that usually aren't even aware of it. And the reason you want to screen is, to protect employees in a workplace, or staff or students at school, even before and after travel. And these are all important, what we call use cases that have really come to the fore in a lot of countries. For instance, there's a policy in the US to test school children, primary and secondary school children, pretty well once a week. That's also happening in the UK. So this can be very, very widespread testing. And this is a new area, and that's what I'm going to talk about today. So typically, these asymptomatic people are described here, all these different use cases that might be multiple testing, where in prisons or nursing homes, you're testing the staff and accommodated people, perhaps even as often as daily in the case of staff, at schools, etc., as we've described. And then you've got the one-time testing, which might be before a cruise, or even going on I know the Philippines provides a stupendously large proportion of the world's mariners. So that's obviously an important case before getting on a ship, before travel, etc. And the need for solutions here, it needs to be low cost. It needs to be easy to use from sample collection onwards. The very invasive brain swab, as we call it, the nasopharyngeal test, is far too invasive for these repeat testing. And you need to be able to process them in the thousands, but we can't afford to have less quality data. So the good news is, particularly for the Philippines, is that sputum or saliva testing is well regarded. There are even recommendations from the Philippines NIH suggesting that it is as good to use as nasopharyngeal testing. So that's something that's really starting to take off around the world, using self-collected saliva testing. Now, there are two key types of tests that are out there. There's what we call a PCR test, or a nucleic acid amplification test. These test the genetic material inside the virus. And then you have antigen tests, which are commonly known as rapid tests. They're quite new on the market, and they actually use antibodies to detect the virus particle itself. I've highlighted the key differences between them. The first is that PCR tests are high sensitivity, whereas antigen tests are less sensitive. They work on subjects or patients with a high viral load. And the good news for PCR is that it is well registered for the use in sputum or saliva tests. So there is a distinct difference between the two. And on the next slide, I'm going to highlight why one type of test, the PCR test, is more applicable for some tests than for some samples than for others. So here's the performance data from one of the most widely used tests in the world. On the right-hand side, we can see the what we call the instructions for use data. This is the data that was provided to the regulator in the US, the FDA, about the performance of the test on a small number of patients, in this case, about 200. And it looks very good, but after release, a study published in the Morbidity and Mortality Weekly Report by the CDC, so it's real life data from a large study of over 1,000 subjects at some American universities. And this did the important case of splitting the subjects between patients, those that were symptomatic, and subjects, those that were asymptomatic, were not sick. And we can see that the data changes very, very significantly. I've highlighted two key parameters. In red is the false negative. These are the ones that everyone worries about, where these are the ones that were carrying the virus but were not detected by the test. And we can see that as we move from the symptomatic patient population, where we miss 20%, in the asymptomatic or well people, we miss 60% or 59% or 3 and 5. But not to be sneezed at, so to speak, is the orange data as well, where the false positives, these are the people that have been declared sick or declared virally infected, but aren't really virally infected. And that number goes from 1 to 1.7%. Doesn't sound like much, but if we look at the use cases, this is a really important factor. So if we look at the area where a rapid test was actually designed for, so a doctor's clinic, a doctor's clinic would, in this case, a general practitioner, he's got 20 people in the waiting room who an anticipated positive rate from testing of about 5%, which is pretty normal. It's as high as 40% in India at the moment, but typically 1 in 20, 1 in 10 people would be positive during a pandemic. So in that 20 people, you would expect to see one person with COVID. And that GP could expect to detect that person today, 80% chance of detecting that positive. But the chance of detecting a false positive, less than 1%. It's probably not going to happen. So from the physician's perspective in their clinic, this is a perfectly good test to use. Now let's go over to a workplace testing environment or a general population screening. In this case, 1,000 subjects might be a better number, and because they're well people, we're expecting to see the COVID at a much lower rate. And 1 in 1,000 might be normal. Okay, so the chance of detecting today's positive, well, it's only 40%. 60% of the time we're going to miss that positive, but we're still going to get 17 positives, or 1.7% of that 1,000 people. So the upshot is that almost all positives are false positives, and you probably missed the negative anyway. And from the workplace environment, if you get a positive, you can't believe it, and you probably missed the positive that was there anyway. So you probably haven't chosen the right technology. Now, rapid antigen tests have been used widespread in the UK in school children screening, for instance. And there's a lot of commentary to indicate that false positive rate actually undermined confidence in the testing regime altogether, because whenever people saw positives, they were almost certainly not true. So the good news is that PCR has evolved. The PCR tests that came out a year ago to fight the virus were first generation, and they went for the best possible technology available at the time. So what's happened since, of course, is a lot of R&D, and we're now seeing systems hit the market that are much more simplified. So this slide shows an updated workflow where essentially the technology's evolved to eliminate an important step in the past, which is extraction, the process of actually cracking the viral nucleic acids out from the sample. And now it is feasible, quite feasible, to use essentially the saliva straight into the PCR test. It removes about half the cost of the test and a significant amount of the workload. It's the actual most labor-intensive component is actually the extraction process. and by shortening things like recycling time and such, that the throughput has changed dramatically. On this slide, we can see a modern throughput, a couple of instruments with 2 operators per shift, able to do about 4,500 results per day, because you can run these samples in panels of 96 or even 384 at a time. So here's a 384 example here, results coming off every half hour or so, 4,500 results per day. So these systems, this is not new technology in the sense of the hardware.
To begin with, so we're seeing more and more of that kind of data. In real world experience, that's what we're seeing in Israel, where suddenly severe hospitalization and admissions and severe hospitalizations are in marked decline. And in the UK, when after they rolled out the AstraZeneca vaccine, look at this, death has plunged to 0. So yes, these vaccines work. Side effect profile to date, mostly pain, redness, swelling, some muscle aches and pains, etc., etc. And there are conditions by which that will highlight whether or not they should observe you for 30 minutes or 15 minutes post-inoculation. And the side effect profile is pretty much the same throughout all of the different vaccines, be it mostly mild to moderate. Some people will have 2 to 3 days worth of symptoms, others just 24 hours or even less. So basically, yes, vaccines do work. These are some of the differences that you can see, or the highlights per vaccine, as illustrated or talked about by Gavi. That's the Global Alliance for Vaccines. They're the ones actually who pulled this particular set of criteria or commentary regarding advantages and disadvantages per different type of platform. So you can visit their website. These are all there. But basically, they work. Vaccines work, ladies and gentlemen. So yes, definitely, when you get called up, please go have it now. Go have it done. Wag na tayo mamili. Don't be choosy or picky between Pfizer or Sinovac or AstraZeneca. They work. So in the meantime, protect yourselves, physical distancing, and all of the other health protocols that are in place. So thank you, everybody, for your listening, and then we'll be glad to take questions later.
Okay, thanks, Dr. Tameses. So yeah, like the takeaway is get a vaccine. But at the same time, in the spirit of the topic today, I think it also highlights that none of these vaccines that you discussed were around, before the pandemic. Am I right about that? Just a quick question.
Well, none of them were actually around this specifically for SARS coronavirus 2,
Right.
but the technology has been studied for many, many years, particularly the messenger RNA, which is totally brand new. This is it's been about 10 years in the making. So this is ngayon pa lang ready for prime time itong messenger RNA. So it was just fortunate, in quotation marks, that the timing of the entry of this pandemic came when people were already prepared. They were already really focused on coronavirus. And we got the genome of this particular virus in January of 2020, when the Chinese released it. And because of that, they're quickly able to scale up and develop the vaccines because they already knew what they were going for, the target. Pinag-aralan na beforehand, so they were actually ready, in quotation marks, to actually deal with this new coronavirus.
Okay, that's a great point. Thanks for clarifying that, Dr. Tameses. Okay, well, I hope to hear from you again later in the open forum. But for now, we're moving on to our next speaker. Yes, we have Ms. Cara Brotemarkel, the General Manager of Roche Philippines. Ms. Brotemarkel will share how important innovations in our current situation and how the pharmaceutical industry is taking part in solving the pandemic. She will also discuss the importance of being prepared in facing future health emergencies. Cara? Hi.
Hi, thank you so much. Let me share my screen. Sorry, give me 1 second while I deal with the usual technical difficulties.
Of course.
All right, I think I got it here. All right, and let me just confirm, I gotta put it in presentation mode. And can you guys let me know if you can see that?
Yeah, we can see it. Advocating for a comprehensive pandemic.
Perfect. All right. Well, good morning to everyone, and thank you for the opportunity to be here today. It's really an honor to be among these panelists because I'm already learning so much from many of you during the talks today. And just as a brief point before I get into my talk, I think it is important to note that Roche is a leading diagnostics and pharmaceutical company that's committed to battling COVID-19 pandemic. So therefore, we are involved in the development and distribution of several diagnostics and treatments used against COVID-19. So I'll be clear about any of our products that are used there as we go through for transparency. But what I'm actually hoping to convey to you today is a broader message, including other perspectives beyond our company's scope as well, just for the benefit of taking a holistic view on the subject of how do we really battle the overall pandemic in a more comprehensive way. So I think the topic here about, how do we think about pandemic response preparedness is very timely since we're coming off of this recent wave of COVID-19 in the Philippines that we all experienced over the last couple of months. I mean, I think we saw that there were many difficulties there, in particular in the hospital setting. And of course, that impacts not just the COVID-19 patients and their families, but also all patients that are looking for service delivery within the system at that time. And even though the situation has alleviated somewhat, I think we must not be complacent. So we really want to think about how do we strengthen our response and our preparedness. And there is this, even with all of the very, very positive developments that we're seeing with vaccines, it's possible that we're going to just continue to live with COVID-19 on a long-term basis. So learning to live with it well, be able to treat it when it does pop up or when it changes is going to be an important part of that strategy. So just to recap on the situational context that we've found ourselves in here in the pandemic, I think what we've seen is that hospitals have really been overwhelmed several times, especially when there are these very large and sudden spikes in demand. And in particular, we see that when there are severe cases that are overrunning the ICUs. And as I mentioned before, this impacts not just those patients, but really everybody that's seeking medical care. And this has been exacerbated by the emergence of these variants, which we tend to see spread more easily. And of course, countries can use lockdown measures, and those are important that everybody follows the all of the different public health measures. And we've also seen the emergence of vaccination as a very, very key tool in addressing the challenge. And I think Dr. Tomesis made that point really clearly with the data of what you see, what happens when we actually get to a large bolus of vaccinated people within a population. And so while these are very relevant tools that deserve a strong focus, I think that we actually have a lot of other innovations that are also available to us that have progressed during this pandemic in quick succession. And so we want to think more broadly about how we can comprehensively respond to this ongoing pandemic. And today, what we see often is that many countries are focused on the more of the extreme left or the extreme right side of the disease. So certainly a key focus has been in the vaccination efforts, and then in a very reactive way to trying to address the hospitalized and severe patients with things like remdesivir or tocilizumab, which is one of the drugs that Roche has, which are not approved for COVID-19, but in lieu of having other options, they're being used in an investigational capacity in many countries around the world. Now, because most countries are focused in these areas, there's this unintended consequence that then creates supply challenges because every country is trying to get a very limited supply at the same time. And these are complex molecules where it takes a long time to ramp up the manufacturing capacity. And so when that happens, of course, we've seen that there are shortages from where we would like to be. And I think that's almost universal at this point across different countries. So this bifurcated approach only addresses some aspects of disease management. And there is a reason for that. I mean, traditionally, up until now, we have not really had a lot of available options that have allowed us to address that big gap in the middle. at least not very effectively. We've had to use more basic options. And so I think what we're seeing is that we can consider now, with more innovations coming in, which I'm going to talk about, is that we can have a more comprehensive overall pandemic strategy that addresses along the entire disease course. And I think it's important that we look at what this may entail. So I'll start with the starting point for the entire pandemic, which is actually in testing. I think my previous panelists covered this pretty well, so I'll go through that fairly quickly, and as well as vaccines, which of course also really well covered. So I'll spend most of my time actually talking about these more innovations in treatment that provide us an option to robustly approach the pandemic management, regardless of where we see it come into our lives. So from a diagnostics perspective, I think this will continue to be a cornerstone of the response effort that we have. The pandemic started with a very simple message of test, 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 because that was primarily what we needed to do in order to identify where the infection was and contain it. And this drove really rapid testing innovation, PCR to antibodies to antigens. And I think our previous panelists spoke really well about the differences between those different technologies and innovation. So this will continue to be important to help us identify and quickly respond to the needs of determining risk, and also recognizing when danger is past, i.e. there is no more infection that's currently present. But going forward, they can also help establish whether there's a sustained immune response, and that's going to be important in the era of vaccination. So we can determine whether people are still having that sustained immunity. So I think it's going to remain a mainstay for our pandemic response efforts. And it's important to continue to innovate in this space. So for example, teletesting and home testing, these really empower people to inform themselves of their risk status and then get help accordingly when it is needed. And from a treatment standpoint, prevention is the key, but innovations in treatment across the disease spectrum will play an important role in the overall success of COVID response in the near and long term. So one of the biggest changes that we've seen from the beginning of the pandemic is that we actually now have options in this space, both prevention and treatment. So we've seen the true power of health innovation delivering on society's needs within this time frame, saving lives and getting people back to their families and being able to contribute as members of society. And as I mentioned, long-term prevention will primarily be the domain of vaccines. But they may not be able to work for the full population. It may take us a while to achieve herd immunity, and that leaves us with a short-term and an ongoing need. And from that perspective, the treatment here, I think the aim is really to reduce the severity of disease and potentially get people, since they're not having such severe disease, also reduce the symptoms, and then therefore the burden that puts on the healthcare system, which allows the system to operate more effectively for everyone within it. And there are a couple of really interesting innovations that we've seen here recently. So the first is neutralizing antibodies. So these are often achieved through an antibody cocktail, and those essentially will bind with the spike protein of the virus and prevent it from causing further harm. And by having two, it actually also prevents the evasion of that virus, which is really important when we think about mutations that are emerging across the world. And these have been primarily seen to work in the mild and moderate disease to prevent people from going into a hospitalized setting and hopefully getting them out of their symptoms sooner. So I mentioned a couple of here. Eli Lilly has a drug cocktail, which is the first one mentioned. Regeneron has been collaborating with Roche on another one, casirivimab and imdevimab. And there are others in development as well. And so far, the early data has been quite promising in that area, particularly for high-risk patients. And those are the ones that are most likely to move on into a severe hospitalized setting. Which has allowed them to achieve an emergency use authorization from the US FDA and other health authorities as well. In addition to that, there's also the direct-acting antivirals, and I think these are very good options as well for outpatient treatment, especially because many of them are an oral formulation, which is very helpful if there's not such a robust infrastructure for infusing an antibody treatment. And so we see several early data from this that seem quite promising as well. So MSD, in collaboration with Ridgeback, they've got molnupiravir. Tell me if I said that right. And then there's also the Atea molecule in collaboration with Roche and Pfizer has shown some early data. And similarly, several others behind them in development. So we've just seen an explosion of innovation in this space. And I think it's very notable that these neutralizing antibodies and antivirals have data indicating not only that they work when people are experiencing mild and moderate symptoms, but we're also seeing some data that suggests that they work in post-exposure prophylaxis, meaning that somebody could have been exposed, but we can actually treat them such that they don't go on to develop the disease or only develop a very attenuated version that's not nearly as severe as what they would have otherwise had. So I think that these innovative approaches are important to look at when we think about adding to our armamentarium in this battle. What should be our strategy for treatment, and what would be our action if we were going to actually move forward on that? And so here, I think, is one proposal of what that can look like. So we can imagine a more rational and differentiated approach to addressing COVID-19 from every angle. This would really give us the opportunity to have a more intentional effort, not just for prevention, but also for preventing the overrun of the hospital system that we've seen until we get to the point where we can truly achieve a herd immunity to this disease. So, formerly what would happen is, people that were mild and moderate, they might be asked to isolate at home. And then if they were experiencing symptoms that caused distress, they would show up in the hospital, and sometimes showing up quite late, or if the hospital was quite full, then that would present a very challenging situation, especially in reference to the constrained supply of treatments in that setting. So in the future, what we could do is be able to know if somebody is high risk. So this is often people with comorbidities that we know makes them susceptible for developing severe disease. And we could intervene at that point with some of these innovative treatment options. And that would provide several benefits, not only to the patient, but also to the health system. So I think that would obviously help to reduce the burden on hospital symptoms by preventing escalation of disease, but would also reduce onward transmission to prevent the likelihood of spreading the disease to others, and reduce the duration of symptoms potentially. So this gets patients back to their families and back to society and back to work faster. So how can we fill that gap? That's really the final question that I wanted to address. And I think there's several things that we need to be thinking about. First is, how do we access these innovations as an options for our standard of care? I think that's really important. And as was addressed in the opening comments, innovations are only so good as our ability to access them. So how are we ensuring rapid, equitable, and sustainable access? And that will require there to be funding, and will also require enabling mechanisms such as the appropriate infrastructure, the health and human resource, and of course the digital components that allow us to use the data that we gather from that to continue to further improve our response over time. So of course, if you're paying close attention here, you may notice that it does spell out SAFE, which I think is a goal that is within our grasp if we truly take a comprehensive approach to our pandemic planning. So this is what I want, where I want to close my remarks by wishing you all to remain safe and healthy now and in the future. Thank you.
All right, thanks, Kara. So yeah, that's a very insightful talk. I really appreciated that longer term forward-looking approach that you brought to the conversation. At the same time, I appreciate that you ended on that note about access. And that's because, you were talking about access to, to health, to more medical access, right? But our next speaker is actually going to talk to us about another issue that also is very related to access, and this is the role of digital health solutions and cloud technology in the pandemic response. And for this, we have with us Dr. Karen Priyadarshini. Dr.
You
Karen,
got it.
I got it? Great, thank you. Right, my name is almost equally confusing for people, so I apologize if I almost...
No problem.
All right, so Dr. Karen will share the importance of having the right digital technology to enable better healthcare services. She will also discuss the role of cloud technology in responding efficiently in this pandemic. Okay.
Are you able to see my slides?
Yes, we can see your slides.
Okay, perfect. So before I start, just enjoyed thoroughly the talk by Dr. Beaver and Kara. Hi, nice to be seeing you at this forum. So really very interesting. And I think both were spot on. And to Kara's point that, you know, it's important to get, and to Dr. Beaver's point, it's important to get vaccinated. And to Kara's point that you really need a system that's equitable. So you don't get vaccinated because you have the wherewithal or the money or you know who's who, but you get it in a very equitable fashion. And I think that's what most of the governments have been trying to achieve. And I also, and this is my personal opinion, I also want to share, I've seen that countries where there is a system to distribute and manage the vaccination have been more successful. If you look at, for example, the US or Australia, even Philippines, where the system is working in many states, the one that Microsoft has developed with our partner, you will see that it makes things easy. It makes things, the communication is much better. People are more forthcoming, for example, in having the vaccination. So I just want to share with you a little bit about the technology that enables that. And I think I have, Paco, 10 minutes.
That's right, 10 minutes.
Okay, perfect. So this is in a nutshell, if you see the entire vaccination chain. So if you look at the red dots, they are the critical ones. And if you look at the purple ones, they are high priority. So if you look at the red ones, you will see that first and foremost, you know, equitable distribution of vaccines becomes very important. Having that access, which is what Kara was sharing, that you need to have that access as well, the affordability. And then of course, being able to kind of, you know, forecast supply and demand, because you don't want demand to be high and no supply. But at the same time, you also need to have resources to manufacture. You need to monitor the adverse events and so on and so forth. So you need a system that's able to manage most, if not all, of these requirements. And that's how Microsoft has actually developed in collaboration with our partner. We've developed, and not just one, but with many, we've developed a simple system to be able to ensure you have an easy, accessible, equitable distribution of vaccines, at the same time managing supply and demand as well. So it starts with the citizen registration portal, where you have a simple portal. The citizen goes in and kind of registers. So if you look at the left side, this is where you self-declare any kind of comorbidities or underlying health conditions you might have. And then of course, any kind of testing history. So for example, have you had COVID before, or have you tested positive for COVID before, and so on and so forth. And as Dr. Beaver was sharing, it's simply because you may already have antibodies. So in some of the countries where you've had COVID or you've tested positive for COVID, you typically have like a 6 months gap before you go in for the vaccination. And then of course you can key in your particulars. This again, if you already have a inbuilt repository which you can upload, you don't have to go in and key in. You can just kind of upload all those details and then choose the site. Which are some of the hospitals that are open to vaccination, and you can choose that. You can choose, you may want to get vaccinated in another city in the Philippines. You may want to choose that. You may want to choose the clinic as well. And then of course you can choose the date. What's the date and the time? And I think here is one of the important things. The system should be able to give the flexibility to make changes, because we all now lead busy lives in terms of working from home, doing a lot of remote stuff, and things change very dynamically. So instead of having to pick up the phone and call the clinic and say, hey, I don't want to come this day, I want to come another day, is there a very quick automated way in which you can change your appointment? And that is what the system is out to do. That's it. With a few clicks, not more than 5 to 7 minutes, you have registered. And if you are eligible and successful, because every government has a kind of a eligibility plan, like in the beginning, you would know that 65 and above, health workers and any kind of frontline workers were given priority. So that's where you can set your so-called rules as to who should get it in different phases. And if you qualify for that phase, you can see the system generates like a QR code. Now, taking that QR code, you can actually go to your clinic And here's the thing, you can take the QR code on your phone, you can take a printout, and let's say worst case, because in many of the markets, 50% of the populations are low tech, right? No worries. All you can do is to just walk into the clinic of your choice and just fill in all that I just showed you. The nurse can have you fill all that in. Now, when you reach the clinic or the hospital, and when they open the doors, they can actually see all the registrations for that day. So how many people are going to get vaccinated on that day, and they can see it on a daily basis, on a weekly basis, so they know what's the demand and supply. Of course, you can always kind of, how to say, we do have AI built models which can tell you what's going to be the dropout rate, what's the actual turnout based on past data. But this kind of helps the clinic to have a just-in-time inventory. You don't have to stock all the vaccines, and some of them could be -70, -20. So you don't really have to stock that. You can have a just-in-time reshelving from your nearest warehouse. And so this is what I was just talking to you about. You can see what's the demand and supply gap. Let's say you're looking at the whole week and you need, let's say, 100 vials or 100 doses, and you probably have only 10 vials. Let's say, assuming each of them gives you 3 doses, so you need to reorder. So these are some of the very simple ways, instead of having to physically check how many vials are stocked in. These are simple ways in which you can kind of have a quick check. And then, of course, now you see the citizen carries the QR code, goes to the clinic. You can just use your phone at the clinic, scan the QR code. Once you scan the QR code, you will see all the details that the individual has entered, all the personal details, the comorbidity. In many of the clinics, you will see that they also have the medical record of that individual. But here's the thing, who's actually going to go and open the system and take a look? So this is where, once you scan with the QR code, it makes it much easier. You have it all there. What are the comorbidities? What has been the COVID test so far? Have they had COVID before? And of course, their personal particulars. So the nurse or the care or the health worker who's actually vaccinating can see all of that in one place. I've seen markets in which, the nurse typically asks the patient, oh, have you had this? Have you had that? I mean, sometimes with people who are elderly, it's kind of confusing for them. So this is where you have all of that in one place, and the nurse really can kind of take a quick look. And then, of course, use the same camera and you can scan the barcode on the vial. It will automatically detect which vaccine it is. It's the AstraZeneca vaccine. And then you can see the batch number, the lot number, all of that already kind of inbuilt. And let's say 30 minutes after the vaccine, as Dr. Beaver was sharing, you might have a little reddishness or a rash or a bit of a lump developing. You can take a quick picture, upload that, so that the clinic would immediately know, or so the doctors would immediately be able to see what is some of the, if at all there's any action that's required, that can be done. And here's the thing, once the patient goes home or the citizen goes home, and let's say the adverse events happens a day or 2 later, you can still kind of just use the same portal and key in and do a teleconsult to say, hey, I really need some medical intervention over here. So make it really easy. And then, of course, there's a communication sent out saying that you need to come back for your second jab on this date. And when the individual comes back, you scan the vial again, and the system will match. If you had AstraZeneca's dose 1, you need to have AstraZeneca's dose 2. So if the system does an automatic check and kind of, if there's an error, it will pop up saying, hey, these 2 things don't match. And then you have the scan, you can see the lot number, the batch number, and so on and so forth. And once that is done, the individual can go back. Now, here's the thing. The system can also enable communication between the first jab and the second jab. Because one of the things we've seen is that, as Dr. Beaver was saying, people are reluctant to come in even for the first jab, but we've seen even dropout between the first and the second jab. So here's where, governments, state governments, stakeholders can actually communicate and remind them, tell them, these are some of the symptoms that you will have, nothing to worry about, some kind of a reassurance that can be done as well. And in some of the markets I've worked with, they've taken it a step further when they've made, they made it into a comic form. They made like kind of little videos out of it so that, people enjoy the messaging as well. And then finally, on the analytics side, when all this data is pouring in, you also want to understand that for a particular vaccine, is it more suited to a particular profile of people? Or do you see a lot of adverse events in a particular group of individuals? Are the elderly having more adverse events, or the younger one? Or is it that vaccine A has more, or vaccine B has lesser. So how do you kind of do the analytics? And that's where we have very interesting pre-built dashboard that you can see over here per city, per state, that you can like literally kind of march out what are the adverse events. And then of course, at a local level, you also want to see, hey, you know, what is the trend? So how many people have vaccinated, what age group, you know, what has been the uptake in different cities? Because it could be that some cities are more cosmopolitan and they kind of are more advanced in vaccinating. Some could be a little more reticent and they may have lower numbers. So is there targeted messaging that you can do based on these analytics that you're seeing as well? And then of course, a trend. Normally we've seen that, you know, the uptake is quite high in the beginning and then kind of plateaus off a little bit. And you want to see that particular inflection point where you want to kind of ingest more messaging or, you know, encouraging people to come in for vaccination as well. So this is where you can see individual day by day as well as cumulative as well. So that's all I had from my end, a simple system to kind of help make the entire vaccination process very easy, but at the same time, encouraging people to go in for their vaccination. Thank you so much.
Thanks, Dr. Karen. You know, seeing your presentation almost looks like what you see in movies. It's so simple and it's so practical.
Exactly. Yeah.
Yeah, and it makes
it's easy to use. That has to be important.
It looks like it. It looks like it. And I mean, as a patient, somebody who's been to the hospital for, you know, over the last, you know, portion of my life, you know, the records and everything, it just seems like it should just be the system already. And it makes me wonder, is this available in the Philippines? Is it?
Yeah, it's already been implemented through our partner solution. It's already running, I think, in 2 or 3 LGUs. So it's already been implemented, and we have it running globally as well. So we have it in different markets, and we've seen that typically when, you know, the process is easier, the vaccination runs faster and smoother. You don't have crashes. We've had governments say that, hey, you know, we can manage, don't worry, which is fine, but the demand is so high and, you know, you got to kind of manage it. And the whole thing that Kara was sharing of equitable, you know, you don't want somebody who can buy the vaccine to be able to get the vaccine, but you want to do it in an equitable fashion based on your eligibility. And what the system does is it phases you out. So you're in phase 1, you're in phase 2, very simple and straightforward. Yeah.
That's great. Yeah. So maybe we'll hear more about that in a bit. But before we do, yeah, thank you. Before we do, we'll go to our last speaker for the day, of the panel rather. And this is Miss Cynthia Clement Duntz, the Vice President and Board Member of the Philippine Diabetes Support and Awareness Group. As part of a patient organization, Ms. Duntz will share her first-hand experience on how innovations and technologies provide better lives to patients. She will also share some insights on how to further improve access to healthcare technologies and services that are being provided by both local and national government. Good morning, po. Ms. Duntz. Oh, you're on mute.
Hi. Hello. Good morning, everyone. I think I am the only one who's not gonna talk about this pandemic. And but we need also to touch something like that topic a few. Now I would like to introduce my group, the Philippine Diabetes, because this is a group of mostly diabetics. Right now we are 20,000 members, and these are composed of Filipinos all over the world, OFWs, even Filipinos on a ship. They sometimes they consult us if they have problems, especially if they don't have immediate access to medical advice. We have also members who are caregivers if they have relatives that they're taking care of, and a lot of health professionals like endocrinologists, internists, and nutritionists and dietitians that can help and are willing to help the members. Now, our first and foremost purpose for this group is education and awareness, because as we know, diabetes can result to a lot of things. Uh, at the moment, I think we're about 6 million diagnosed diabetics and about another 6 million undiagnosed. And this is sort of like a pandemic in a sense.
Sorry, you're on mute again. Sorry, po.
Well, anyway, if you have diabetes, you are susceptible to have all the other problems. No, cancer, kidney, liver, everywhere. And we as a patient, we share experiences, and I consulted some of our members also with regards to their problems in dealing with the initiatives of the government agencies about public health, about the initiatives of DOH, LGUs, and I would like to commend Makati for really helping Makatizens. I am from Makati, so they innovate. Like during this pandemic, they have free medicine, and they, instead of you going to their pharmacy, they deliver it to you, and that medicine is already good for 3 months. They have free laboratories, free doctors, free hospitalization, and I really congratulate our mayor for continuing that legacy. With regards to the vaccination, I've heard a lot of people complaining, but in Makati, smooth, fast and smooth. I am now fully vaccinated, and I think it took me less than an hour when I got there, and finish in less than an hour. That's how smooth it is. Now, with regards to education and awareness, it is really important for our health uh, uh, professionals, or for the patients too, to educate, because prevention is a lot better than the cure. Uh, we try our best. We consult with doctors. We do activities with some health medical organizations, medical professionals, and like yesterday, we have what to eat, what is good to eat, how to read a nutrition facts. Those basic things are very important for diabetics, because those are the ones that actually can save you from getting worse. And second, I would like also to thank DOH for their initiatives like the free maintenance medicine, uh, the implementation of the MRP, the maximum retail prices of maintenance medicine. What we are having problems right now is the medicine like losartan, metformin, and other. because I don't know what's the problem. Maybe I talked to somebody and a year ago we received about hundreds of metformin who are nearing expiration. So I had to distribute it the soonest. And last year, we received about, from another group, we received about 600 vials of insulin, which are also nearing expiration. I have been contacted by some barangay, like a barangay captain from Cavite. So they asked for some, so I distributed. I guess I gave about 50 vials each. But the problem is, a lot of health centers don't have refrigerators to keep it. So house for because it needs to be refrigerated. I don't know. When that is what I would like to discuss. The What can we do to improve? Does this free medicine that our government is, because a lot of places like out, most of them are outside Metro Manila. And the last thing that I would like to discuss is the insulin access program of DOH, because right now there are only few accredited hospitals, and a lot of our members, they even had to travel to Manila, and some members actually offered it for the members. They asked for a copy since a lot of prescriptions now are digital. So they asked for the prescription and a copy of the ID, and then they are the ones who goes to these outlets. And according to them, a lot of those outlets does not implement strictly the health protocol, especially now during this pandemic. As we know, the diabetics are high risk. So that we can think of innovations and solutions to this problem. And that is all I can say. And thank you very much for giving me the chance. Good morning.
Yes, thank you, Ms. Dance. The hearing the perspective of patients on the ground is, of course, essential in any discussion about public health and effective and efficient public health. So the points you raised, you really highlight. It's not just about having these innovations and technologies, but having access to them as well. And we appreciate you raising that point. So at this point, I would like to thank all of our panelists who, thankfully, and I am grateful that you've been able to keep it within the time limits of our program, because now that's given us, some time for the open forum. And for the open forum, I just wanted to kick it off. Before I kick it off, could I please, I wanted to point out to our participants that you can use the Q&A function of Zoom to throw your questions, any questions that you may have for our speakers. We have a team that will be going through them, and I'll try to get through as many of them as possible with the time that we have. All right. Maybe to kick it off, I'll start if Mayor Binay. If Mayor Binay is here.
Yeah, I'm
Nice.
still.
Thanks. Thank you, po. I wanted to ask you the first question, in part because, Miss Dance, the last speaker was talking so much about how she was happy to be a Makati citizen and how she liked all of the programs that your city was implementing. So I have a question here. Uh, and the question is, Mayor Abby, given the various health and digital programs being implemented by Makati City, how how can this be efficiently implemented without the bottlenecks of the government procurement process? This can be a model for other LGUs. So we're seeing if we can use the Makati model for other LGUs. What do you have to say about that?
Okay, usually the usual problem for procurement is they procure in advance the medicines, and you have the issue of stock inventory. We don't have that. We have a existing. I'll have to double check if it's what kind of mode of procurement we used, but we have an existing drugstore, which is Planet Drugstore. So it's a drawdown facility, meaning we only pay what we use. So we don't have to procure in advance so much of this um, medicine, except for vaccines, because for vaccines we have to buy it in advance. So we don't have any issue of storage, we don't have any issue of spoilage, we don't have an issue of uh, stock, because we have an existing setup, which is a we have a fund wherein they just whatever we consume, that's the only thing that we pay for.
Well, thanks, Mayor Bina. It's very interesting to know. Uh, I'm sure the participant who asked that can share some of your best practices with the LGU that they had in mind. I have another question here for you, Mayor, and this is actually from the chat box, and it says, "Good morning," referring to Mayor Binay. "How does the LGU of Makati address the digital divide?" You've addressed this, I know, with the Wi-Fi, the free Wi-Fi that you presented earlier. But how does it attend to the needs of those citizens without access to technology? Also, can you elaborate more on the bureaucratic boundaries that you mentioned earlier? Thank you.
Okay. Well, that's the reason why in my first presentation I made reference to our PPP, which is the free internet, which we started in 2017, just before the pandemic. So before we even talk about digital innovations, you have to talk about interconnectivity. You have to talk about connectivity. So we established the fiber optics with our partner for the entire city. That's why we're able to give free internet access to our residents. That also became handy with our online classes for our kids, for our public school students. Um, we for senior citizens or those who are not very tech savvy, who are having difficulty in registering for our vaccination, and as well as this is part of our tutorial for those that are having difficulty in online classes, we launched that Jeepney Maki. The Jeep, we rented Jeeps. It has a computer, it has internet, it has a tutor or a teacher that helps or facilitates the person, whether it be a student who has issues with her online classes, or a senior citizen, or any person who's having difficulty in registering online for the vaccination rollout. So we do address the issues of digital boundaries. You can even use your cell phone to register online. You don't even need to use a laptop. You can also use your cell phone for telemedicine. Um, so it doesn't have to be so high tech. It shouldn't be high tech for you to be able to give the services to your people. Bureaucratic red tape, there's a lot of that. um, but I think as long as there's no national participation, you're okay. We do try to address the concerns of people quickly. Also, that's also the reason why we do have our presence on the social media platforms, so that we'll be able to know the concerns quickly and address them as well.
Yeah, thanks, Mayor Abby. Actually, that's one thing really that I think over the last year, a lot of Filipinos have realized or grown more appreciative of. It's the responsiveness of LGUs, of the LGU leaders. And, thank you for that. But yeah, let's not go down that route. And instead, let's ask a question for Richard. Richard, we have a question here, and it's about testing. In order to get us back to work, school, or travel, when and how often do you recommend an individual be tested? Is it yeah?
Okay, so thank you very much for the question. It's actually a very good and pertinent question. For a high risk environment, such as something like staff in a nursing home, the reality is that testing needs to be frequent. I've seen a number of publications and studies out there that would recommend something as frequently as every second day. So that is quite frequent, and one of the key drivers for getting away from the very invasive nasopharyngeal swabs. It's just not tolerable to have that invasive swab process as frequently as that, and it's also requires a large amount of trained staff, whereas things like saliva testing can be done simply by having someone supervise people dribbling into a tube on their own, and one person can supervise a number of those. It's really just about making sure they don't get mixed up. It's not a difficulty. So yeah, so for some high risk environments, there's no doubt you need very frequent testing in order to protect things like old, immunocompromised people who vaccines might not take well in. In other places, obviously less frequently. And there are also many other strategies that you can do. For instance, if you have family groups for travel, can you really argue that you need to test each person individually, or can you put them all in a pool? Pooling 5 samples together is a very valid way of getting quite sensitive testing. You lose almost no sensitivity, but reduces a lot of burden. You can do school groups similarly, that's being seen in the US. So there are all sorts of ways of reducing the burden, and it really does depend a bit on the use case.
Great. Yeah, thanks for clarifying that, Richard. Okay, we actually, one thing I noticed about our discussion is, we've had speakers talk about innovation in terms of the development of testing, of vaccines, but also in terms of these digital technologies. And I was wondering, and this is not really a question directed at any specific speaker, but given, the importance that we see, the value we've given these innovations, and really developing them fast to respond to what's happening now and what could happen in the future, what sort of support or programs from government do you think we need to support this innovative direction that the Philippines requires? Maybe Kara, who would like to weigh in, given of course that she discussed more of that future forward-looking perspective.
Yeah, sure. I can start and kick it off with a few thoughts, and others can kind of build from there. I think one thing that we mentioned was just the challenge of being able to respond to the dynamics of the pandemic. And I think there is an opportunity for the government to be able to, really consolidate what are the demands, and then ensure that there is a quick and very responsive way of communicating that, and then on our end, on the manufacturer side, ensuring that we then can also put supply in there, and that can be through advanced purchase agreements and other things like that. But that it needs to be a very simple and clear process, so that it's not only that we're getting those sorts of innovations in very quickly in a very responsive way, but then that they can also be distributed. And so we talked a little bit there about the equity. So if we have a more transparent and consolidated system that tells us where the demand is and how it's changing on a very real-time basis, and I think this is where a lot of the digital tools and data can be really extremely powerful in how that can happen. Then we're able to not only keep up with what's happening in the moment and meet those demands, but also ensure that it gets to the right places at the right time. So that's kind of just some initial thoughts on my end, and where we can kind of take a whole of society approach, really, with all the different players doing their part to respond to the challenges that we see, including the government.
Thanks, Kara. Dr. Beaver, would you like to weigh?
Yes, this is always a very touchy subject, and I think it's really important that our processes must be much more agile. It's right now it feels a bit difficult. I mean, like, I can remember early days, Kara and I were chatting all the time. Can we get your product in at the earliest possible time? How can we move this? We had to really intervene all the time with the powers that be, getting them to talk to customs, assessing how quickly things can move through the system. Right now, it's quite, I mean, like remdesivir, for example, it's still under compassionate use. More than a year into the pandemic, every hospital still has to apply for that permit to be able to use remdesivir for their patients. It's been a year after we've started this adventure, in quotation marks. Why do we still get the difficulty in getting supply in on a regular basis, the forecasting? All of these issues have to be really worked at, and we need to streamline a lot more of these processes. Now, innovation, newer therapies that both Kara and I were talking about now, we're trying to already alert the minds of our regulators that these potential therapies are coming. Let's put together already systems so that we can allow the quick entry of these new treatments, assuming that they actually prove to be efficacious and actually work, right? I mean, like, these things have to be put in place, these systems. The sense of urgency really needs to pervade throughout the whole system and every single person involved here. Obviously, this pandemic is not the new everyday normal. Who wants to live like this all the rest of our lives, right? We don't want this. We need to be faster. We need to be able to adapt quickly.
Thank you, Dr. Beaver. Maybe Dr. Karen, you're one of our speaker from the technology perspective. Like,
Yep.
is there anything that you would like to see, or how do you think we can prepare or be more open to these innovations in cloud and AI? Like, what else could be done so that we're more adaptive to that sort of thing?
Yeah, that's super interesting, Paco. In fact, today morning we had a whole forum where we were discussing this, that technology is great to have, but it's more the adoption that's the problem, right? How do you kind of get people to adopt to something they should? I think in terms of the vaccination per se, what we have seen is that the ease of use, if it's something that's easy to use, and also the communication part. Like, I think I saw one of the questions in the chat, like, I'm scared about the adverse events, because social media has been playing its part in kind of, creating that fear that, you may have some great reactions and so on and so forth. So like in Singapore, what they've done is they've kind of put in an assistance plan that in case you have very severe reactions and you're admitted, the government would take care of the expenses. So things like that kind of help assure somebody that, if things do go south, there is a support mechanism. So I think that becomes super important, that you be able to kind of be with them. So it's not like, hey guys, you go get vaccinated and that's your problem. No. if the government can work with these citizens and say, hey, I have your back, go in for the vaccination. If something happens, we are here and we are here to communicate. And I saw that question as well, you know, where we've seen a lot of communication with the, not just vaccination. If you were to just, there was this article in Forbes where they were looking at why have some market been able to quell it so well, the COVID, and some, you know, it's been ravaging the whole country, right? And we've seen, I mean, this is just an observation, that most of the leaders in those countries were women. And apparently women over communicate. So they would send out, as leaders, they would send out multiple, you know, kind of communications to the citizens in a regular fashion. Like, this is what we're doing, this is what we're going to do next. And we've seen that people comply much better when they know what's happening. So I think the whole vaccination piece, that is very critical, getting the citizens with you, getting their trust that, you know what you're doing and it's in their betterment. I think that's a non-tech part that's very important.
Yeah, but at the same time, Dr. Karen, do you think that like the use, and I'm riffing off of a question in the Q&A, but do you think the use of IT platforms increases, like you said, confidence or maybe accessibility to vaccines?
I only cover JPAC. So what I can definitely tell you is that, and this is not kind of blaming anybody, but when we've spoken to state governments and central governments, and we've spoken in terms of IT adoption, some of them have been super reluctant. And some of them have said, oh, we know our stuff, we know how to take care and all. Now, what's happened is that, you know, COVID has all its twists and turns. I'm speaking to you from Singapore. We had everything so well managed. And suddenly you see this whole spurt. And so I think from last week, we are under lockdown again. So the idea is that you really can't predict anything. So it's better for you to have a system that can switch on and off different elements, right? So you want people to come in for vaccination, there has to be a system that switches on. You want people to kind of come in later for the second dose. Is there a way to switch that on? So I think that kind of system, if it is there, it makes it easier for people to get vaccinated. And we've seen a higher uptake and even confidence when those systems work. Yeah.
Okay. All right. Yeah. Thanks for that, Dr. Karen. You know, I actually just have one more question, but I also see that Mayor Binay, did you want to answer? It says Mayor Binay is typing an answer. Did you want to answer it live instead?
Yeah, I'll just answer it live. It's easier to explain. We have already vaccinated over 50,000 people in the city. In terms of adverse effects, and when we say adverse effects, these are effects that require hospitalization. We have 0 reported adverse effects after vaccination. If you do get adverse effects that require hospitalization, I have been assured by the NVOC, by the NTF, that that there is the indemnity fund, that there is a fund that will pay for any hospitalization caused by adverse effects from the vaccine. So I keep on telling them, you assure people that in case they get sick because of the vaccine, they'll readily get vaccinated. Because there's that fear that if they get sick, who's going to pay for their bill? That's one of the concerns that also needs to be, it's part of the information dissemination that needs to be done by DOH to encourage people to get vaccinated, because the LGU are the vaccinators, we're the foot soldiers. But this is a national initiative that I think the DOH and the NTF needs to further strengthen by saying and assuring people that if you do get sick, we will pay for your bill.
Okay. Yeah. Thank you, Mayor Binay. Before we close, I just wanted to throw out one more question there, and anybody really is free to chime in. You know, we've been a lot of the discussion today revolved around, you know, that multi-sectoral collaboration, and a lot of our speakers mentioned it, partnering, you know, between LGU, national government, civil society, patient groups, as well as with the business sector, with the private sector, with the you know, technology and pharmaceutical developers. Does anybody have anything that they want to share, maybe on on the importance, how important collaboration is moving forward in addressing the and fighting this pandemic. Maybe.
Okay, I'll go first.
Yeah, thanks, Mary Binay.
Okay. I heard the presentation of Microsoft. I'm on the practical side because I'm the one applying what they're presenting. That's why there's always a need for collaboration, because it might work on when you think about it, like when you do it in the laboratory, it might work, but it actually doesn't work when you do apply it. One of the challenges that we have encountered with the online registration, it's the frustration of people to register, or that they also don't disclose the truth. They don't write or input the right information. They register under the category seniors, but actually they're not seniors yet, thinking that if they do register in that portal, they will get their vaccine already. There are people that registered in their name, but actually they're registering for their parents. Those are practical issues that we do experience on the ground, or multiple registrations, thinking that it will bring them higher up the ladder by registering several times. So the collaboration with the tech and the practical side, which is the LGU side, is always very important. Even in testing, I do agree with Mr. Richard Harrison. There are still people that don't want to be swabbed because of the fear. There's this fear that it's going to hit their brain or something. I mean, those are misconceptions that the reasons that they say that's why they don't want to be tested, the same way that they don't want to get the vaccine because of issues from Deng Baksha experience. So there always needs to be close collaboration. I would like to say, or special mention, Dr. Beaver. Thank you for the presentation. Very, very enlightening and interesting, because we kind of get lost with all that technical explanations, but you presented very well on the differences of the vaccines. And it's difficult for us to explain to people, please do not choose choose a specific brand. They are all the same. But again, there are, with the help of their doctors, the doctors are also the ones that prods their patients to choose a specific vaccine. I guess again, there are certain people that do have medical conditions that is a reason why they are qualified or not qualified for a specific vaccine. But as Dr. Beaver said, they're all the same. They have the same effect. It's just that it's presented differently to your body. So I hope we do also send that message that the vaccines are all the same. Don't choose whether it's a Western brand or a Chinese or a Russian brand. They all have the same effect, because all we want to do is to reach our herd immunity so we can all have a Merry Christmas. Thank you.
Indeed. Something to look forward to. Richard, Kara, Dr. Beaver, Ms. Dunst, did you want to weigh in?
Well, what I want to say is we do need to, one group that we don't have in this forum right now is media. And that the vaccine word came out again already earlier. Let's face it, that was a manufactured crisis. And media drove that. So we need media to be a partner to really drive home again and correct this misperception, which was also partly the fault of the manufacturers of some of these Chinese vaccines, because they did not disclose their information properly and timely. Timeliness, full disclosure will really go a long way towards improving perceptions, and that's marketing 101. That's really marketing, right? We need to correct these perceptions. We need to get it out there that the main purpose of vaccinations is to prevent disease. And at this point in time, they all deliver. So that's fantastic results. So we should be actively communicating this with through our media partners loudly, repeatedly, over communicate, as what you've already mentioned that women leaders do.
Well, I think you'll be happy to hear, Dr. Tomesis, that we actually do have several of our media partners in the room, and I'm sure they heard your message. And let's see if they can broadcast that as well. Help us. Anybody else? Richard.
As our group, as a patient, even this morning, I received a message asking, are the vaccines okay for us diabetics? And I get those questions 5-10 times a day. And what we usually do is like, that we have a member who is a pulmonary specialist. So she created a video explaining vaccines, and but not all the members can watch it because they are using free data.
Right. It's access.
So it's the access again. So it's better for you to explain to them via messenger, text messages. So I think it's like the problem with the LGUs like Makati, they have free Wi-Fi, but sometimes it's too slow because I guess a lot of people are using it at the same time.
Yeah.
And I don't know. I mean, maybe we should have. Well, for us diabetics, I would like to emphasize that, like in Pasig City, they have this what they call diabetic center. They have a clinic where every Wednesday diabetics go there. Sometimes they give free blood glucose checking, something like that, and some seminars. They teach you about everything about diabetes. I hope LGU and like us, we are willing to help. We are willing to help, and there are a lot of professionals who are willing, medical professionals who are willing to help us, help you.
Mm-hmm.
Even the LGUs.
Yeah, po. Yeah, so I think you're right. Yeah, po, no? It's really, when we talk about a multi-sectoral effort, it's essential when it comes to educating people and getting people the right information. Okay. So we're a bit over time, but Richard and Kara, if you guys wanted to have a few last words, then please.
Well, thank you for the invitation, Fargo. I just wanted to make a last comment, sort of addressing your initial question at the start of the Q&A was, what can government do to help with coordination and such. I've been very fascinated to watch the level of coordination that's clearly happening and to see great initiatives like Mayor Abbey talked about online vaccination booking and such. I wish I had that here in Melbourne. Ours is nowhere near so well organised. But there's an interesting conundrum that's appearing, which our team at Thermo Fisher are spending a lot of time with, and actually happens at the international level. We have a unique situation here in Asia where travel has essentially ground to a halt. And this is quite different to the Americas, LATAM and Europe, where because everyone's sort of equally affected, they've continued a lot of travel. But in Asia, travel is down to a few percent of what it was pre-COVID. Borders are closed. And there is no alignment between governments as to what's an appropriate standard for testing before travel, what's an appropriate quarantine when we get there. As vaccination increases and the borders start to push open, that's something that I think governments with goodwill will really need to start to talk to each other about how to open their borders and still protect their populations. And at the moment, there's been no real global leadership on that. So just a comment.
Thanks, Richard. All right.
Yeah, maybe just a quick one from me, because I think it's a lot that has already been said. But, I think what I really appreciate about the forums like this one is that you get to hear, from so many different perspectives coming together. And I think it is very much true. And we've all realized this through the pandemic, that really collaboration is the only way through it. We're going to need kind of all these different sectors of society in order to actually find the solution. And because, as soon as we solve one thing, we kind of see that next block that we have that we come up against. And I think, it's very easy for us to get, focused on, our own particular areas that are in front of us, the big challenges that we're all working through in problem solving. But what I think we want to do is keep that open perspective. How do we really look at all the different facets and be able to, essentially, we have to, yes, prioritize, but, tackle them in a very holistic manner. I think we see this in so many different examples that we have, and we talked through a few of them today. And I think discussions like this are a great way to help foster that cross collaboration and discussion. So, thank you for providing the forum for that to happen. And I think the more that we can do it, the more quickly we can find solutions to some of these challenges.
Great. Thanks, Kara. And I think that's a great point to close the open forum on. So with that, I'd like to thank all of our speakers, all of our panelists today for sharing their insights and answering our questions. At this point, I'd now like to turn the program over to Mr. Orlando Oxales, our partner, and he's a convener of Citizen Watch Philippines, to formally close today's event. Mr. Oxales?
Thank you, Paco. Thank you very much. On behalf of the allied health advocacy groups of Universal Healthcare Watch, the Philippine Alliance of Patient Organizations, Health Justice Philippines, the Philippines Diabetes Support and Awareness Incorporated, Citizen Watch Philippines, and Bantay Consumer, Calzada Corriente, or BK3, we express our sincere appreciation to the organizers, Strat-based ADRi, its President Professor Dindo Manhit, Executive Director Paco Pangalangan, and ADRi team, our esteemed speakers from the Department of Health, Dr. Enrique Tayag, our Honorable Mayor of Makati City, Mayor Marlene Abigail Binay, the President of the PHAP, Dr. Beaver Tameses, a very important industry now, General Manager of Roche Philippines Incorporated, Ms. Cara Brotmarkel, Regional Business Lead of Worldwide Health of Microsoft Asia, Dr. Karen Priyadarshini, and Vice President and Board Member of the Philippine Diabetes Support and Awareness Incorporated, Ms. Cynthia Clement-Duns. The devastating effects of this global health crisis has exposed the vulnerabilities of our public health system, with the universal healthcare law is envisioned to solve. The world now realizes the interlocked relationship of health, the environment, and the economy. And having failed to maintain a balance in these ecosystems has resulted in catastrophic and existential consequences that we are now battling to survive. A global health crisis that has become a transformative event that will change how we must live beyond this pandemic. As keeping one's health is now the most important concern before everything else, the government must prioritize the implementation of the Universal Healthcare Law as a strategic pillar of economic stability and growth. As advocates, we call on all stakeholders to join our call to transform our health system based on these principles of universal health care. First, accessibility. All patients have the right to access the health care that they need when they need it. Second, patient-centeredness and equity. All people, regardless of disease or condition, age, gender, race, or ethnic background, sexual orientation, geographical location, sociocultural background, economic or legal status, must have fair and impartial access to quality health care. We must put an end to the risk of medical bankruptcies or the economic medical catastrophes befalling a family because a loved one falling victim to a disease or devastating accident. Choice and empowerment. All patients have the right to know about the healthcare services that are available. Patients must be able to meaningfully be involved in healthcare decision-making at the local and national, regional, and global level. We must nurture a culture of disease prevention that starts from early childhood to senior care, from vaccination, nutrition, and healthy lifestyle. Fourth, quality. It is not enough for all patients to have access. Healthcare services must be safe, of the highest attainable standard, and include a commitment of learning and improvement. Patients need to define what constitutes quality in healthcare, and high standard services must be assured in every healthcare facility of the country. Fifth, partnership and collaboration. Patients have a moral and ethical right to play a meaningful role at all levels in health and in other areas that can have an impact on well-being. Sixth, sustainability and the value of healthcare. All stakeholders need to recognize the value of healthcare when considering investing in universal healthcare coverage. And seventh, accountability and transparency. This is vital to delivering safe, effective, and affordable healthcare. All stakeholders need to be held accountable on their commitments to implement universal healthcare coverage and be accountable to the patients they serve. Realizing these principles will need partnerships and collaboration in all of society approach that will mobilize the resources and expertise of all sectors. Crucial to achieving a truly responsive healthcare system is the government's investments in the public health facilities and the integration of the best health technologies. The fast response of the pharmaceutical industry to develop vaccines and medicines to fight COVID-19 has been unprecedented, which further highlights how innovative health technologies have been critical in fighting the pandemic. However, this pandemic actually has multiple victims: the people infected by the virus and those who are immunocompromised, or those with non-communicable diseases like hypertension, diabetes, and cancer. The top causes of death in this country. According to WHO, delays in diagnosis, interruptions in therapy, and even abandonment have increased significantly. And we have seen how this last surge in COVID-19 cases is limiting the access of non-COVID patients needing immediate and maintenance treatments. In fighting the pandemic, digital technologies have become the virtual lifesaver that provided alternative modes of communication and cloud-based solutions that are now essential tools for continuity of all economic activities. We must harness the full potential of these new technologies and transform our health institutions and practices. Digitalization of the Philippine health system will replace old, slow, and leakage-prone manual processes with fast, accurate, efficient, and transparent digitally powered operations. With the digital transformation of our health ecosystem, the fragmentation issues in service delivery of local health systems can be harmonized. The resulting operational and cost efficiency will save financial resources that can then be channeled to further expanding accessibility of medicines and treatments for the bulk of the populations who cannot afford out-of-pocket expenses for their medical needs. A digitized mode of pooled procurement of medicines and equipment, as mandated in the UHC Act, will be more effective in providing medicines to our marginalized sectors who cannot even afford to buy, even with price control measures. The enlightening talks of our esteemed speakers have appropriately contextualized their insights towards recovering from this pandemic. The drive for health innovation empowered with digital technologies has become the world's primary weapon against COVID-19 and is indispensable in rebuilding a post-pandemic world that will be more prepared for the next deadly virus. The world cannot afford another global pandemic. As infections continue to spread, plus the absence of universal healthcare coverage, access to reliable and affordable medical and health services is a daily challenge faced by a vast majority of Filipinos. Every Filipino has the right to health, a right intimately related to right to life, which is recognized in several treaties and covenants the Philippines adheres to, the Philippine Constitution and domestic laws. We must re-emphasize the importance of community and patient involvement in building our public health system. While we recognize the experts must be on board, people in communities and patients should never be forgotten. Lived experiences and feedback are key to sustaining our public health system. It is important that government look at health services as an investment for the long term, and the inclusive development that they keep on promising, particularly the Ambition 2040 of NEDA. Private sector participation and innovation is needed, but at the end of the day, health is one of the core services that the government must provide so we can ensure that no one is left behind. Let us raise our collective voice and call on our country's leaders to action. We call on the key stakeholders, patients, health professionals, patient organizations, local communities, the healthcare industry, and the government to proactively collaborate in the decision-making process so that through this whole of society approach, the country's health systems could achieve better health outcomes with a greater sense of accountability in healthcare delivery. We appeal to the government to prioritize the implementation of the Universal Healthcare Law, together with our other health laws, and allocate adequate resources for their operationalization based on sound data and evidence-based information. On behalf of Strat-based ADRi, UHC Watch, and all the participants, we thank all our speakers for yet another instructive gathering. Stay safe, healthy, and happy.
Thank you.
Thank you.
Thank you, everyone.
Thank you.